Welcome everyone. Thank you for joining us today. My name is Dr. Wajid Ahmed. I'm the Medical Officer of Health for Windsor-Essex County Health Unit. Teresa Merentet, our CEO and CNO, will not be joining us this morning. There are 126,417 confirmed cases of COVID-19 in Canada and 41,695 cases in Ontario. Chatham-Kent has 360 cases, and Sarnia-Lambton has reported 338 cases. Michigan now has 99,200 cases, with 13,516 cases in Detroit. Today, we are reporting 2,335 cases of COVID-19 in our community, an increase of 12 new cases from yesterday. 2 are farm workers, 7 are close contacts of a confirmed case, and 3 are still being investigated. Overall, 26% of our cases are between the ages of 20 to 29 years, and 24% between the ages of 30 to 39. 65% are male and 35% are female. 2,331 cases are now resolved, and 82 cases are being active and being followed by our health unit. 5 people are in the hospital, with 2 people in ICU. Our community has lost 72 people to COVID. 50 deaths have occurred among residents in long-term care home and retirement home. 2 retirement homes are currently experiencing a COVID-19 outbreak, as well as 3 workplaces, 2 in the agri-farm sector and 1 in the manufacturing sector. Yesterday, the Ministry of Health released COVID-19 guidance for school outbreak management. This outbreak management guide highlights the roles and responsibilities of schools, school boards, local public health unit, and other health system partners to contain and manage a potential COVID-19 outbreak in the schools. An outbreak in a school is defined as 2 or more lab-confirmed cases of COVID-19 in students and or staff in a school with an epidemiological link within a 14-day period where at least 1 case could have reasonably acquired their infection at the school. This includes school transportation or after-school care program as well. During an outbreak in a school, similar to outbreaks in other settings, the health unit's role will include, from a prevention and preparedness perspective, advise schools and boards of education on COVID-19 prevention and preparedness in conjunction with Ministry of Education and Ministry of Health. From a case and contact management perspective, receive, investigate, and manage reports of cases and contacts of COVID-19, including any potential notification to schools' principals, director of education, if a case is identified in a staff, student, or essential visitors. From an outbreak assessment and management perspective, investigate clusters of cases, provide guidance and recommendation to the school on outbreak control measures. Provide recommendations on cohort isolation, potential need for full or partial school dismissal, based on the schools and the outbreak situation. Make recommendation on who to test and support in testing as per provincial direction and recommendations. It also includes conducting an on-site investigation when it's necessary. From a surveillance perspective, monitor local epidemiology related to the local transmission risk. From a coordination and communication perspective, ensure that all communication with relevant stakeholders, including Ministry of Health, Emergency Operations Center, Board of Education, coordinating any public communication with Board of Education and Ministry of Health, and develop key messages and communication principles with everyone. Schools and school boards have a general duty under Occupational Health and Safety Act to take every precaution reasonable in the circumstances for the protection of a worker, including with respect to infectious diseases. They have to follow all the relevant guidance from the Ministry of Health, Ministry of Long-Term Care, and local public health unit. They must keep a record of all individuals in the school each day, including complete contact information.
Felicia Lowell, please call 1451. Felicia, call 1451.
They must keep a record of all individuals in the school each day, including complete contact information, regular cleaning, and health and safety measures, including ensuring access to appropriate personal protective equipment, soaps, and hand sanitizers. As well, schools must regularly screen students, staff, and visitors for COVID-19 and exclude anyone who is sick. It is also important that we understand the role of everyone in keeping our schools safe and free from COVID-19 outbreak. When it comes to our roles and responsibility in managing ill individuals in school settings, for parents and teachers, they must monitor their symptoms and symptoms of everyone in their family and exclude anyone from school who is sick. The school administrator should be aware of all public health resources to enable them to safely manage individuals, for example, students, staff, and essential visitors with signs or symptoms of COVID-19 in these school settings, including how to wash your hands, fact sheet on self-isolation, self-isolation guide for caregivers, household members, and close contacts, etc. Parents must also ensure that they screen their children daily and do not send them to school if they are unwell. Parents should also work with their children and the school to prepare their kids for a day of learning in a new environment, including proper use of face masks and educating them about physical distancing. When there is an outbreak of COVID-19 in a school, this may lead to suspension of entire class, busing groups, after-school care, cohort being excluded from school, and directed to self-isolation and testing to limit or stop further spread of COVID-19. In order to prevent an outbreak and ensure that disruption and risks are kept to minimum, it is critical that parents, teachers, schools, and school communities all do our part to keep our communities safe and healthy. Thank you.
We will now take questions from the media.
The conference is now unmuted.
We'll start with AM 800.
Hi, it's Christy Lee. Just a couple of questions of clarification. How many cases, Dr. Ahmed, did you say are active?
82 cases.
Okay.
So maybe, yeah.
Sorry, go ahead.
Yeah, so there may be some numbers I can see that it may be off, but the total number of cases is 2,335 and 82 cases are active.
The number of resolved cases is 2,335?
No, that's the number of active cases. So I think the number of resolved cases are off. So maybe we'll just stick to the total number of cases and the number of cases resolved. Those are the most accurate one. And we reported, Christy Lee, last week that there's a migration that's happening with the system. So we are trying to do our best to provide you with the most accurate information, but some of that information is limited by the migration effect. What I can attest to is the number of total cases and the number of resolved cases based on our record.
Okay, so yeah, I'm just a little bit confused because like on the website it says confirmed cases is 2,489.
That's right.
Confirmed.
2,489, that's correct, sorry. I didn't hear.
So sorry, Christy Lee, once again, I apologize. I think whatever you're seeing on the web, I think that's accurate.
Okay.
And yeah, so and again, we anticipated that some of these challenges, and again, I'm doing the numbers today, and please accept my my apology. And whatever you're seeing on the site, that number is the most accurate one. And use that number, please. Thank you.
Okay, I just want to make sure because when I put it up on the website, the Facebook comments always go nuts. So
Okay.
I just wanted to clarify then again,
Okay.
The current outbreaks at long-term care or retirement homes. The website is showing an outbreak at Shoreview at Riverside where 4 staff have tested positive, and I also reported that yesterday because it's on the website, and I got some emails from people saying that there is no outbreak at Shoreview.
Well, I think we rescinded that outbreak recently, and I have to just make sure that it's reflected there. I know I have worked with my team to rescind that outbreak, so maybe it's just a matter of updating our website. But that is correct, that Shoreview is rescinded.
Okay, and is there still the outbreak at New Beginnings with 17 residents and 4 staff?
That is correct, yes.
Okay, perfect. Sorry, everyone. So then, just on the back to school plan, can you say, I know when there's head lice or chicken pox, that, typically in my experience, a letter would be sent to at least in the minimum everybody in the class saying this has happened in our classroom, and then sometimes the whole school gets that notice. Will that be the case for COVID?
So the understanding and expectation is if there is a case which is reasonably acquired and spent some time in the class setting where there is potential exposure, then there will be some kind of a notification and or if there's a confirmed case. I don't anticipate that every time someone is going in for an assessment and after the assessment, if it was deemed that there was no risk or no concerns identified for COVID, that communication would happen. And obviously we want to make sure that the communication is happening with the right intent, and it's you know, if we are sending too much information or alerts, it probably loses its value. So we want to make sure that you know, when there's a risk, that risk is communicated and people are notified. In most cases, as we are talking about these cohorting, that all these students who are cohorted, they need to be notified and followed appropriately in terms of communication.
Okay, and so are you in agreement with the province's plan? Are you happy with how things have been laid out by the province and, you know, the health unit's role in the back to school plan?
So I think what we have been trying is we are working with our school board to provide these guidance to the best of you know, our abilities to monitor some of these situations and also to have some good plans in place. And it does requires everyone collaboration. And I've said this in the past that you know, it is none of these plans are, you can say it's 100% safe. There's always a certain level of risk attached to it. And again, everyone's risk tolerance is different. Everyone's needs are different. Some people do not have the option to keep their children at school for various reasons. Because people do not have the access, the ability to keep their children at home. So they have to send their kids to school for studies. And again, overall, from a broader public health perspective, it is the learning environment in the school is much better than the learning environment at home. So I think it just depends on various levels of risk that we are all willing to take and accept and try to make decisions which is in the best interest of ourselves, our family, and our unique needs of our children. So our plan, that's the first thing that it touches, that you have to look at your unique needs of the children. And all these plans are developed with the best interest of balancing all the risk and mitigating some of the potential risk that may arise. No plan is perfect, but I think you know, we'll have to look at our local-ish situation and how we can do locally to support our school boards and to provide them with the right guidance, which we've been doing. And I think it's an ongoing process. We keep learning. There are new things that are being added every day. The conversations with the school boards are happening regularly. And we hope that at the end of it, we have a plan that is that helps to keep our children safe in our community.
Okay, thank you. I'll let someone else have a turn now.
Any questions from Blackburn?
I see that your page is live now for the information for parents. So just with, we highlight again what you're recommending parents do, what's important for them to highlight for the children as they go back to school.
Well, I think some of the key thing is obviously talk to your children and identify their needs. Help them understand what COVID-19 means. I'm sure that many parents have already done it, but it may not be a bad idea to talk to them again. Help them with their understanding of what COVID-19 is, how do you protect, how do you put yourself at risk, and most importantly, when you are out with the other students, other children, your friends, how do you behave? How do you want to interact with them? What about the physical distancing piece? And I know some of this information your children may not understand, and everyone have a different level of understanding. But at least from a basic perspective, how to wash your hands properly, how to maintain your physical distancing, how to wear a mask properly. I think those are the key pieces that we need to understand. And also, you know, going back to the same principles of limiting your number of people that maybe your child is physically interacting with. I know kids tend to group together. There is no such physical distancing for them. and ensuring that that they understand and they try to at least limit that as much as possible, and having a good understanding of your child's healthcare needs. If there are any reason for your child to that puts them at a risk of higher risk of developing more severe consequences or a severe outcome, talk to your healthcare provider. Help them walk you through with some of the options. There are options available with online learning, with in-class learning. So I think they should go back and they should review it. Talk to your child about the appropriate process, like how to hand wash properly, wear a mask, find a mask that your child will wear, and not a mask that that they don't want to wear. So maybe just make it more interesting, more fun for them when doing this type of thing. So I think just the engagement piece would be important with your child before you send them to school.
Thank you.
Any questions from the Windsor Star?
Yes, good morning, Dr. Ahmed. Is the website with guidance for parents and guardians and kids, is that the wechu.org/cv information-parents-caregivers? Is that where it's live?
If you go through the school, there's a school button.
So what my team is telling me is that if you go to our website on COVID-19 page, there's a school button. And then if you click on the school button, then it would take you to all the resources that we have.
Okay.
Yeah.
Thank you. That's everything for now.
Okay.
Any questions from CTV?
Yes, good morning, Doctor. A couple of items here. First of all, since we're talking about schools, I'm wondering, because we're only like a week and a half out, are you concerned that teachers might be overwhelmed? Because I don't think they've received their guidance. I don't think they know what rules are in place yet. I don't think they know Ohio right now. So is there concern from the health unit that teachers might be overwhelmed heading into all this?
So I think I would defer it to our school board partners that they should be on top of this, and some of these discussion and conversation have been happening for quite some time now. So I think it's not a matter of whether I am concerned. I think they should feel comfortable, just like we are in the last 6 months. Things come rapidly, and we have to adapt quickly. We have to respond quickly. And I think there is enough time and opportunity for all of us to identify what exactly is our needs and how do we meet those needs. And again, going back to the same answer that I've given, there is no risk-free option. There's nothing that you can say that it's 100% risk-free. There is none. So we just need to make sure that how do we do our work? How do we continue on with the rest of the activities in a manner which is safe, and that would be that will keep our community safe. So I think the bottom line is they should connect with their school boards, make sure that whatever their concerns are, whatever their issues are, they're talking to the school board. I may not necessarily be aware of everything. Our role and our guidance is directed to ensure that they have all these systems in place and all these policies and procedures in place, which we hope that it would be there when the school starts. Okay.
Thanks for that. Shifting gears, let's go to the drive-thru at St. Clair College. Do you have updated numbers on that yet, or is it too soon? Because I figured a lot of people drove through during those 2 days.
Yeah, so it would be hard for us to do that, Bob, because we no longer receive results of all the negatives, and obviously it was not an initiative through the health unit. So I'm not the ordering physician, so even I won't get a negative copy from that perspective. If there's a positive, we will get a copy of that, and I think when we get the positive, we will be in a position to, excuse me. Identify if it was part of the drive-through testing or not, and maybe we can report that. But so far, none of the results are positive that we have seen as a result of that testing. I think the hospital, I don't know what their plans are, whether they will plan to do some kind of a debrief with how many they tested and how many positive. We can only report the positive, and we will do that when we have that information.
Oh, okay, so it's fair. I guess it's fair to say you haven't gotten that yet. Then, okay.
Yeah.
Okay, so any questions from Windsorite?
Not right now, thanks.
Any questions from CBC?
Yes. Hi, Dr. Ahmed. So I'm just wondering why boarding houses are allowed to exist, particularly in Leamington, when zoning bylaws do prohibit them.
I don't know how to answer your question. It's not my jurisdiction, and I think that question should be referred to the agencies or the municipalities. If it's not allowed, it's not allowed. I don't know how to answer that question. It's definitely not a health issue that I can answer.
Or maybe let me rephrase a bit. So what role is the health unit playing, I guess, in monitoring those types of boarding houses, just to make sure that they are safe for agri-farm workers to be staying in?
So from the farm workers housing, so that's different, because then every temporary foreign workers that are coming to the country, they have to have the employer or the growers are responsible for their housing, and there are certain checks that needs to happen to give them permit to operate. So anyone who's registered in that program, they need to have the houses inspected by the public health unit, by the municipalities, and followed by the appropriate municipal bylaws and fire code, building code, and everything. So from a public health perspective, which is again focused more on the health side of the things, we have been doing and providing all those recommendations. The municipal perspective, I think there are certain issues that that they have identified, and it's being worked on right now, and hoping that we have all those deficiencies that are currently existing in the system that can be fixed. But from our perspective, obviously, we have been providing our recommendations purely on a public health requirement piece under the regulation, under the guidance, so which we have been doing since the beginning of this pandemic, or even before then, because we obviously do that inspection before a temporary foreign worker arrive in Canada.
Thank you. And then just another question. I know that some other jurisdictions have opened up their public drinking water fountains or created guidelines at least around maintaining them during COVID. Have there been these conversations within public health? Like, are you guys looking at certain guidelines to recommend to the city in terms of reopening that source of water?
I'm not aware of any direct conversation. I do know that there were a couple of question that was brought to this session, and also we looked at some of the other municipalities and their direction in terms of the water fountains that are out there. There is nothing to say from a public health side that it shouldn't or it should be there. We definitely recognize that it's a public service, availability of water, and if people can safely operate it, and if it can be maintained appropriately. And again, it's unfortunate that a lot of the time it's and again, I'm just speaking here as a pure lay person, is we have to take the responsibility of everything. We cannot hold accountable everyone, like the municipalities or others, that, why is that not safe, or not, why is it, this is happening. If I'm accessing a water fountain, I want to make sure that, if I'm getting water from them, how can I safely get it? And obviously, there will be other people who are using it, how they're using it, whether they have washed their hands before they touched the button, or the water spout where the water is coming from, how close someone would be was there, and how it can be managed. And if I'm filling up my water bottle, what does it look like? So from an evidence perspective, obviously, there are some recommendations and some guidelines out there. But I think as an overall, we haven't had any landed on any specific recommendations that yes, they should be up and running at all times, and this is what their operation should look like. I think there are some guidance in terms of when you are using it, how do you use it safely, and what is your responsibility, etc. So those things have happened, but no specific position that we have maintained in a public health community to say yay or nay to these type of water fountains.
Thank you so much.
Any further questions from AM 800?
Sorry, the health unit website isn't saying, but I know you said, Dr. Ahmed, can you just remind me again how many people are in the hospital and how many of those are in the ICU?
So 5 people are in the hospital with 2 people in ICU.
Okay, and 2 in the ICU. Okay. Yeah, I think that's it. Thank you.
And I apologize for the confusion in the number, and it's I'm trying to cover for Teresa, but maybe I'm doing a bad job in covering the numbers.
No, it's okay. I appreciate the information and the clarification.
Yeah. Okay.
Any further questions from Blackburn?
No, thank you.
Any further questions from Windsor Star?
No, thank you.
Any further questions from CTV?
No, but good job, Dr. Ahmed.
Thank you, Bob. Really need that.
You can always count on Bob for a compliment.
That's it.
Yeah, I'll save that comment. I'll play it to Teresa. Otherwise, she'll just be upset that how bad job I have done. Even one day she's not here.
Any further questions from Windsorite?
No, thanks, but you did a great job for Teresa.
And any further questions from CBC?
I'm good. Thanks, Dr.